Good afternoon. My name is Chris Dorn. I'm the Senior Manager for Public Policy here at CADCA. We thank you all so much for coming and attending this very important webinar on the President's Fiscal Year 2026 budget requests. I'd like to introduce our panelists, Sue Thau, who is our Public Policy Consultant and an expert on all things President's budget. So without further ado, I'll turn it over to her.
Hi, everybody, and I want to start by saying welcome, and also that, yes, this is being recorded. The recording will be available, and I think a link to it will be sent out tomorrow to everybody that has signed up for the webinar. So thank you so much for your attendance today. So we're going to be speaking about appropriations and the whole process from soup to nuts. So the Constitution says no money shall be drawn from the Treasury, but in consequence of appropriations made by law. What that means is Congress has the power of the purse, and ultimately it's up to Congress to appropriate money for all of the programs in the federal government. So how does the appropriations process typically work? Well, it's supposed to start in February when the president submits his budget request to Congress. And then the process goes through, and then the fiscal year ends on the end of September. And at that point, all 12 appropriations bills are supposed to be passed into law so that the new appropriations year or fiscal year can start on October 1st. But Congress has not passed all of its 12 appropriations bills on time since 1997, which is why a lot of you have heard of things like minibuses, which are putting a number of bills together and passing them as a package, or omnibuses, where the whole federal government's money is in one big package, or continuing resolutions, CRs, which is what we're operating on for the rest of this fiscal year. So this year's timing was really exceptionally late for the president's budget to be released. And interestingly, a tremendous amount of time and effort by the Hill and by people like CADCA, who are trying to influence the outcome of the appropriations process. A lot of that effort happened before the president's budget was actually even released. So Congress began working on the appropriations bills before May 31st. As you know, the administration also made some major staffing changes, did some major layoffs. A couple of examples are that a number of the project officers at CDC, where ONDCP subcontracts the Drug-Free Communities program to, had not been federal employees for 2 years, so they were laid off. And for the CDC, the excessive alcohol program, which is one that we are very interested in, the staff that worked there were laid off before the end of 2025, even though the money had been appropriated for those programs. So CADCA has done a tremendous amount of appropriations advocacy since the forum. Basically, we started working on this when you guys came to town in February. We focused basically on 3 appropriations bills that are led by 3 appropriations subcommittees. The first one is the Financial Services General Government Subcommittee that oversees all of the funding for the Office of National Drug Control Policy and the programs there. Then the Labor, Health, and Human Services and Education-related agencies subcommittee, where all of the programs in health and human services are appropriated. We also work on the State Foreign Operations Appropriations Subcommittee for all the State Department programs of interest. Now, what we do every year to advocate for appropriations is tremendous. And I want to thank Chris Dorn, who introduced me, for all the hard work that he's done, and our whole team at CADCA. Usually the first thing we do is analyze the president's budget. This year didn't come out until very late. So what happened was every single member of Congress at the beginning of the appropriations season has the ability to pick their priorities for each of the 12 appropriations bills. And they open this up by providing specific appropriations forms that people, like their constituents, CADCA and others, can fill out, making the case for why the things we care about, they should make their priorities when they get to ask the appropriators to make their priorities important in the process. So basically, Chris and team completed 6 to 8 appropriations request forms to over 200 Hill offices for about 1,200 to 1,600 forms that we submitted before the president's budget came out to members of Congress to make substance use prevention one of their top priorities when they ask the appropriators what they should focus on in making sure things got funded. We also met with tremendous amounts of members of Congress and their staffs to make the case for substance use prevention. I personally meet with the committee staff of the chairs and ranking members for the 3 appropriations subcommittees I told you about, plus the offices of the full committee chairs and the ranking members of the appropriations committees. We also met with every member of all of the 3 appropriations subcommittees, and we got them packets that I'll describe in a minute of all of the information that they would need to make the programs we care about priorities for them. We also do appropriations sign-on letters, which is working with Congress to have them do what's called a dear colleague and send around a letter saying, please support the Drug-Free Communities program or some of the programs in the Center for Substance Abuse Prevention, and make that one of your top priorities. And that ends up being signed by members of Congress and members of the Senate, and also goes to the appropriators so they know that there are members that really care about these programs. So we sent packets detailing all of our appropriations priorities to all of the appropriations committee members, and we requested that all of the programs of importance to the substance use prevention field be funded at the highest possible levels. The Drug-Free Communities program, the CARA Section 103 Enhancement Grant Program, all of the Stop Act programs, including CDC's Excessive Alcohol Use Program, the Strategic Prevention Framework Partnership for Success Grant Program, the Substance Use Prevention Treatment and Recovery Block Grant, CDC's Office on Smoking and Health, and CDC's Division of Cancer Prevention and Control. And these are the programs I'm going to go through in a minute and explain exactly what's being proposed in the president's budget for them and what we are fighting for and what we're going to ask you in the field to follow up and fight for as well. So what do we include in these packets? Well, we put together state and district specific information on the programs, application statistics, how many people have applied from their state or their district for each of the programs, how many grants they can be given out, national level outcome information, also information for their state and district on outcomes from the programs, information on how the funding is proposed to be cut or underfunded in the president's budget request, information about why and how substance use prevention is unique, and then the specific asks and the justifications for those asks. So we do these packets for every member of all 3 of the appropriations subcommittees that I mentioned in the beginning of this. Now, one of the things we point out in every one of these packets when we're making the case for substance use prevention is that substance use prevention is unique. It's not doing mental health promotion specifically. There's definitely overlaps there, but the point is, unless you're specifically dealing with reducing access and availability, changing community and social norms, changing perceptions of harm and social disapproval and risk, perceptions of parental attitudes, perceptions of peer attitudes, and other factors, as we know, outlet density, the products, how they're being marketed and promoted, price. Unless you're doing all of this, you're actually not doing bona fide substance use prevention. And unless you're funding people to actually do this, nobody is going to be doing it. And that's one of the core messages that we have used that's really been effective in making the case for substance use prevention, is that it's not just general prevention to build strong, healthy, and resilient kids, which is critically important and certainly a large part of this. But this stuff is very unique, to substance use prevention. We also share the national level outcomes for the Drug-Free Communities program, which are extremely robust and show that we have made major strides in reducing alcohol, tobacco, marijuana, and prescription drug use to levels much lower than national averages. We also show that substance use prevention is totally underfunded. You can see this shows the difference between substance use treatment and other downstream approaches and prevention funding. And as you can see, the downstream approaches have gone up remarkably since 2018, and yet substance use prevention has really remained relatively low. So we are already underfunded and underutilized as far as the impact that we can have on reducing population levels of use. We share reductions in specific grantees in their states and districts. So if we're meeting with members from Tennessee, we show them the outcomes from their state or their district. And we do this for every single packet that we submit to members of Congress and when we meet with them. And we also have local people on the calls with us to be able to speak about the reductions and how they've achieved them by doing the strategic prevention framework and implementing CADCA's 7 strategies for behavior change. The other thing that we do is get something called report language included in the appropriations reports. These basically are communications from Congress to the agencies that helps them understand in more detail than in the bills what they're supposed to be doing with the money that's been appropriated. And an example is every year for the past 5 years, CADCA has worked to get the following language in to the appropriations bill for labor, HHS, and education for SAMHSA that instructs them that all of the funding provided to the Center for Substance Abuse Prevention, as well as the 20% prevention set aside in the Substance Use Prevention Treatment and Recovery Services Block Grant, shall be used only for evidence-based substance use primary prevention activities and not for any other purpose. I talked about the sign-on letters. This year, we did the Drug-Free Communities sign-on letter. Our champions in the House were Representative Brian Fitzpatrick from Pennsylvania and Paul Tonko from New York. Our Senate champions, Chuck Grassley, who's been our champion every year since the program started, and Senator Jean Shaheen from New Hampshire. And Senators Fitzpatrick and Tonko also wrote letters in support of the STOP Act and the Strategic Prevention Framework Partnership for Success grant programs. The goal of these is to get as many members of Congress as possible to sign on in support. And this year it was funding the Drug-Free Communities program at the highest possible level and keeping the program funded in the Office of National Drug Control Policy. We had 61 members of the House of Representatives sign on to the House version of that letter, and 25 senators signed on to the Senate version of that letter. These are really important because they show the appropriators that these programs have broad bipartisan bicameral support, and they make a very, very big difference. Before and while these letters were circulating, we got an alert out, and CADCA members sent over 2,000 messages to the Hill asking their members of Congress to sign on to these letters. And it was extremely helpful in getting the turnout that we got and the support that we got. We also have done legislative alerts this year asking the field to ask their members to make sure that the Drug-Free Communities program and CSAP's programs of regional and national significance were fully funded and got a tremendous support for those. So what has the field done to date working with CADCA? You responded in record numbers to coming to go to Capitol Hill Day during the forum. That's the beginning of the appropriations process every year. And those meetings mean a lot because when we follow up with our appropriations requests and they've already met with you, they go, oh yes, we know those people. We heard from them. We know that what they're doing is amazingly important. So nearly 4,000 messages have been sent from CADCA members to Congress through our legislative alerts. Over 2,000 were sent on our alert on CSAP, and 1,800 were sent through the alert asking people to sign on to the DFC appropriations letter. CADCA members have also participated in numerous meetings with their elected officials since the forum during the appropriations process to make the case for all of the programs of interest to our field. And I'd like to thank everybody who's participating for their sending the alerts, pushing the button, and doing the meetings with us afterwards. Now, I want to just take a minute to say substance abuse prevention has already, since fiscal year 2010, been cut by about 27%. We lost the Safe and Drug-Free Schools program in 2010. That was never authorized and appropriated again. We lost the National Anti-Drug Media Campaign in 2012. We lost the Enforcing Underage Drinking program in 2015. So really the programs that are left in fiscal year 2025 that are specifically substance use prevention programs are Drug-Free Communities, the Comprehensive Addiction and Recovery Act in ONDCP, the programs of regional and national significance in the Center for Substance Abuse Prevention, and the 20% set aside in the Substance Use Prevention, Treatment, and Recovery Block Grant. So that makes up basically the $752 million in current funding for substance use prevention. So we know that we've already been cut, and we know what is remaining as far as the programs. I just showed you the chart. So now I'm going to take you into what the fiscal year 2026 President's budget request is asking for the programs that fund our field. I want to start by saying there's a lot of ways to eliminate a program, and they don't all have to do with just eliminating the funding. The first thing is you can just cut the funding for a program so that there aren't as many grantees and there aren't as many people running it. You can eliminate the funding for a program, which is called zeroing it out. You can leave the funding for the program, but cut the people who manage the program so that it's very hard to get the money for the program out the door. You can change the scope of a program by consolidating funds from various programs and then opening up the new program that's consolidated all the funds to issues that have nothing to do with substance use prevention or whatever issue it is you're consolidating funds for. And you can do some combination of everything above. This becomes really important as I'm going to go through what the President's budget has proposed for all of the programs that fund our field, because it's a combination of all of this. So what is the President's budget request, or what we're going to call the PBR? Basically, the President comes up with a proposal that he or she sends to Congress that is their blueprint for moving forward for how to fund all of the programs in the federal government. It's non-binding. It's a President's request. The President's budget request, or the PBR, does not represent any final numbers for federal programs and what's been appropriated, because the first slide I showed you, Congress has to pass appropriations bills, which then are either signed into law or vetoed by the President. So I want to talk for a minute about the administration. The President's budget request is requesting that the appropriators start a totally new agency called the Administration for a Healthy America. This is proposed as a consolidation after cutting and recommending cuts to a number of federal agencies that are very important to our field. Okay, so the new agency would include the following subcomponents: primary care, environmental health, but the most important one to us is that they basically move whatever they have left of SAMHSA, HRSA, and a couple of other agencies into a subcomponent of this Agency for a Healthy America called Mental and Behavioral Health. This Agency for a Healthy America does not actually exist at this point. It's not authorized, but this is what they are proposing as a reorganization of the Health and Human Services Department to do a lot of these issues, including mental and behavioral health. So the proposal in the president's budget is to merge all of the current agencies that are listed below into this new Agency for Healthy America, into the sub-agency for mental and behavioral health. So it's the Office of the Assistant Secretary for Health, the Health Resources and Services Administration, the Substance Abuse and Mental Health Services Administration, the National Institute of Environmental Health Sciences, and several centers and programs formerly in the Centers for Disease Control and Prevention. They don't move these intact into this new Agency for a Healthy America. They propose to cut a lot of the people and programs in these and then consolidate them together into this new AHA and the Mental and Behavioral Health Sub-Agency. So what are they recommending in the president's 2026 budget to the programs in the Office of National Drug Control Policy? So we all know the DFC program, central bipartisan component of nation's demand reduction strategy, signature program for coalitions. You all know that. So what are they proposing? The president's budget request for 2026, first of all, proposes to move the Drug-Free Communities program out of the Office of National Drug Control Policy and into this Mental and Behavioral Health Sub-Agency in AHA. Okay, they propose to cut the program by $39 million or 36% from $109 million to only $70 million. It's not clear from the president's budget when it finally came out exactly how they're going to do this. The one thing we know is that they're claiming that there's funding for 560 grants, and they got that number by taking 70 million, dividing it by 125,000, which is the maximum amount per year DFCs can get. And the 70 million divided by 125,000 came out to 560 grants. A lot of issues with this. The first one is there are over 600 continuation current grants that would need to be funded. That means that of those, some would not be funded. There's no money for new grants, and therefore the total number of grants could be reduced from 750 to 560. But here's the real kicker. There's no funding provided for program evaluation, technical assistance and training, program management, the DFC, the data collection, or the administration of the program. So to be able to actually administer the program at $70 million, it probably would be that there wouldn't even be money for 560 grants at $125,000. Either they'd have to cut the amount of funding each of the grantees got, cut the number of grantees. So this is a very draconian proposal because there's no way to have a program and not have anybody administer it, not have any technical assistance and training, and not have any evaluation. So we're extraordinarily concerned about this proposal. And this is what CADCA is recommending to Congress, and we have a lot of support. We want to, one, keep the program in the Office of National Drug Control Policy and fully fund it at the FY 2025 appropriated level of $109 million. Obviously, we want to keep all the continuation grantees. We want to make sure there's money for new grants to be awarded. We want to keep the number of grants nationally at about 750. We want to make sure that the National Community Anti-Drug Coalition Training Institute is funded to give training and technical assistance to everybody. We want to make sure that there's funding for program evaluation, not only for all grantees to get their data back, but for the national evaluation. And there's funding for the management and evaluation system and for employees and project officers to continue to be funded so that ONDCP can continue to subcontract with CDC to do the management of the program. So that's what we're recommending for the program. Moving on to the Comprehensive Addiction and Recovery Act. As you know, that is an enhancement grant to allow current and former drug-free communities grantees to do more with more intensity to reduce opioid and stimulant drug misuse. There were grants for $50,000 a year for 5 years. The president's budget totally zeroes this out. This program in the president's budget is eliminated. It's not moved to AHA. And it would basically defund all of the current grantees if in fact Congress goes along with this proposal. CADCA's recommendation is to fully fund the program at $5.2 million, the current funding level, and keep it funded in the Office of National Drug Control Policy. The HIDTA program in ONDCP, the High Intensity Drug Trafficking Area program, is basically slated to be moved out of ONDCP into the Justice Department, into the Office of Justice Programs, and to be cut by $102.5 million, be cut by $102.5 million, sorry. So cut from $298.5 million to $196 million. Again, our recommendation is to keep this program at ONDCP and fully fund it at the $298.5 million level. We have a lot of support on the Hill for drug-free communities and HIDTA programs. We have the letters, we have a lot of people lined up, and we're hoping that we can keep this in ONDCP and keep these programs fully funded. So now I'm going to move on to the Substance Abuse and Mental Health Services Administration and what the president's budget is proposing for those programs. The president's budget proposes to cut about $1 billion from SAMHSA's budget. Most of the cuts come from getting rid of the programs of regional and national significance across SAMHSA's 3 centers: the Center for Substance Abuse Prevention, the Center for Substance Abuse Treatment, and the Center for Mental Health Services. So there was a skinny budget that came out before the full budget came out at the end of May, and that's where it was released of what they were trying to do to SAMHSA's budget. And basically what they said was the budget proposes to refocus activities that were formerly part of SAMHSA and reduce waste by eliminating inefficient funding for the mental health programs of regional and national significance, the substance use prevention programs of regional and national significance, substance use treatment programs of regional and national significance. They're claiming that these programs either duplicate other federal spending or are too small to have a national impact. That's the justification that was given for cutting almost all of the programs of regional and national significance in SAMHSA. Our rebuttal to that is, especially in substance use prevention, we have not only always had little bits of money, but we've used them to great effect and achieved major population level reductions in substance use with the tiny amounts of money that we have been given from the federal government. There's very little money, therefore there's almost no duplication. In fact, the core substance use prevention programs that still exist are synergistic, they complement each other, and they help with the growth, development, and sustainability of the substance use prevention infrastructure at the state and community levels. So what are they proposing happens to the core federal substance use prevention programs in the Center for Substance Abuse Prevention? So for the Strategic Prevention Framework Partnership for Success program, that has been funded historically at about $125.484 million in 2025, but that's about the amount of money we've gotten for a while. You know what it does. This funds a lot of you. It provides funding for comprehensive state and community-based substance use prevention strategies. It uses the SPF prevention framework model and has been effective in reducing underage drinking and illicit drug use for 12 to 20-year-olds. Currently, there are 177 funded community grants, 38 funded state grants, and 18 funded tribal grants. This is another thing that we've used on the Hill. The Notice of Funding Opportunity that was released earlier this year received almost 500 applications for only 40 grants that could be awarded. So there's tremendous pent-up demand for substance use prevention programming and already a little bit of money. For the states, they got 21 applications for 6 new grants. And the president's budget proposes to eliminate this entire program, to zero it out and get rid of the entire $125 million. So what is CADCA's recommendation and what have we worked for all along and we're working for now? We recommend that SAMHSA and CSAP not be dismantled. However, we have information that, especially in the House of Representatives, they probably are going to go along with the using the appropriations process to set up the Agency for a Healthy America. So if in fact they decide to dismantle SAMHSA and stand up the Agency for a Healthy America, we're requesting that the Strategic Prevention Framework Partnership for Success grant program should be actually fully funded and moved to the Agency for a Healthy America mental and behavioral health thing. We're hoping that that doesn't happen, but we have to have the money for this program. It's a core infrastructural program for substance use prevention. The next thing is the STOP Act. There are a number of components. I'm going to go through all of them. The first one is the community-based coalition enhancement grant program that you all know. Basically, current and former drug-free communities grantees are eligible to compete for funding to get $60,000 a year for 4 years to do more with more intensity around underage drinking. It's the only federal grant program specifically that works to reduce underage drinking. That has been funded at $11 million a year for 2025 and a number of years before that. STOP Act grantees have achieved major reductions in youth alcohol use, and also notice of funding opportunity announcement that went out earlier this year received 155 applications for only 13 new grants that they would be able to award. So again, amazing pent up demand for substance use prevention programs through the STOP Act that there's almost no money for as it is. We have amazing outcomes from STOP Act grantees that are much steeper than reductions nationally in underage drinking. There's a couple of examples. And that program, and I'll show you in a minute, is slated to be totally eliminated, wiped out. They're going to try to get rid of the $11 million. The second component in SAMHSA of the STOP Act is this adult-oriented national media campaign, which has been funded at about $2.5 million. And the purpose of that is to increase actions by adults to discourage underage drinking and decrease adult conduct that facilitates underage drinking. This is also slated for elimination in the president's budget request. And here are examples of what that program does. The third component in SAMHSA of the STOP Act is the Interagency Coordinating Committee on the Prevention of Underage Drinking, or ICPUD, funded at $1 million a year. This basically brings all of the federal agencies that have anything to do with underage drinking together, and it also collects data on patterns and outcomes of underage drinking. But they also summarize state reports that are extremely important. So the president's budget proposes to eliminate all of the STOP Act programs in both SAMHSA and CDC. CDC has a tiny $6 million excessive alcohol program that has already basically, even though the money in FY 2025 was appropriated for it, they eliminated it and already fired the people who worked on it. But the president's budget proposes to eliminate all STOP Act programs in SAMHSA and CDC. What's CADCA's recommendation and what are we asking you to also push for? We're recommending again that SAMHSA and CSAP not be dismantled, but if Congress decides to dismantle SAMHSA and stand up the Agency for Healthy America, the STOP Act programs need to be fully funded and moved to AHA's mental and behavioral health section. The STOP Act Enhancement Grant Program and the National Media Campaign are the nation's only federal programs specifically dedicated to reducing underage drinking, which is our nation's top substance use issue among youth. And therefore, we feel very strongly that this program needs to be continued. And again, as I said at the very beginning, we have been working since the forum to make the cases for all of these programs and their importance, and Congress gets it, and a lot of members of Congress have made these programs their priorities. So we have heard from a number of Republicans that are on these subcommittees that they are pushing to keep these programs funded, even if in fact they end up standing up the Agency for Healthy America. So I want everyone to know there is hope. That, I'm not doing this just to tell everybody that everything is doom and gloom. Because of all of the work that all of us together have done since the beginning of the appropriations process, we feel pretty strongly that we're in good shape. So what happens to the other programs in the Center for Substance Abuse Prevention? And there's a number of them: Tribal Behavioral Health Grants, Minority AIDS Initiative, the SPF-RX, Minority Fellowship Program. All of those programs are also recommended for being zeroed out in the president's budget. So what is CADCA recommending? We're recommending that all of CSAP's programs of regional and national significance should be fully funded at the 2025 appropriated level of $236,879 million. We do not want to see CSAP decimated. That just would not work. So what does the mental and behavioral health subcomponent include for prevention in the president's FY26 budget request? Well, it moves, as you know, the drug-free community proposes to move the drug-free communities program to this part of AHA at 70 million. It keeps the Centers for the Advancement of Prevention Technology, which are really the PTTCs, funded or recommends at current level of $9.43 million. It keeps the Science to Service activities in CSAP, but renames them Substance Use Disorder Prevention Engagement Initiatives for $4 million. But really what that does is try to integrate substance use prevention with mental health promotion. So basically it recommends the total in this new AHA mental and behavioral health subcomponent would only be $83.565 million. And as you know, at the chart that I showed you at the beginning, when you took DFC, the programs of regional and national significance in the Center for Substance Abuse Prevention, and the money in the 20% prevention set aside in the Substance Use Prevention Treatment and Recovery Block Grant, that was like $750 million. And basically what we're left with here is about 83.5 million. So it proposes to basically decimate the infrastructure for substance use prevention. In a minute, I'm going to get into what happens to the block grant set aside. So for the Center for Substance Abuse Treatment Programs of Regional and National Significance, they are proposing to eliminate all of those, which is about $576.2 million. So there wouldn't really be any programs of regional and national significance left in CSAT. Now in CMHS, the Center for Mental Health Services, they are not proposing to zero out all of them, and I'm not going to go through every one of these programs. As I said, these slides will be available, as will the recording of this, but they're keeping 988 suicide crisis lifeline, some other suicide prevention stuff, the Child Traumatic Stress Network, and a number of other CMHS programs are continued, but they are proposed to be moved into the new mental behavioral health subcomponent of AHA, the Agency for Healthy America. Now, what happens to the block grants? Basically, the president's budget is proposing the creation of a new block grant called the Behavioral Health Innovation Block Grant, or the BHIBG. This is proposed to be a combination of the Substance Use Prevention, Treatment, and Recovery Services block grant in SAMHSA, in CSAT, of about $2 billion. It combines that with the State Opioid Response, or SOR, grant program that's currently $1.575 billion. And it also puts the Community Mental Health Services block grant of $1 billion all together into one big block grant. But it's only proposed to be funded at $4.1 billion. So this consolidated block grant that would be used for both behavioral health, so basically for all of the substance use prevention, treatment, and mental health initiatives, it would represent a cut of about $457 million from what was the total of putting all of three things together. So that would have been 4.583 billion would have been the combined number for those programs. So one, they're putting substance use and mental health together into one big block grant, and two, they're proposing to cut the total by almost $500 million. Now, approximately 80% of the funding for this new behavioral health integration block grant would come from the substance use prevention and treatment. This is I'm sorry, this should have been changed. It would come from substance use prevention and treatment related sources. Most of it is treatment. As you know, there's only a 20% set aside for prevention. So one, it's unclear how much of the money in this new block grant would be dedicated to substance use issues generally. And the other thing is it's totally unclear what would happen to the 20% prevention set aside in the current substance use prevention, treatment, and recovery services block grant. That's the largest single funding source for substance use prevention at $401.6 million. And it's just not at all clear that we would keep that, which is why in the total that we showed you for what was moved to AHA, we didn't include this because it's actually not clear in this proposal what happens to the 20% prevention set aside. It's a really big problem. So what's our recommendation? And we're working with a number of other groups in the field to push this. We totally oppose merging the Community Mental Health Services Block Grant with the Substance Use Prevention, Treatment, Recovery Services Block Grant, and God, what is SOAR?
State opioid response.
Right, the state opioid response money. Right. We, however, would support transitioning over time all of the funding from the state opioid response grant program into the substance use prevention, treatment, recovery services block grant by either moving $250 million a year or $500 a year to allow states to have time to adjust to the difference in the formulas between those two grant programs. We do not want to see SAMHSA dismantled, but if Congress has decided to dismantle SAMHSA and stand up the Agency for a Healthy America, then we want all these three grant programs fully and independently funded when moved to AHA. So there's what we're asking for. Obviously, we don't want to lose the 20% prevention set aside in our current block grant. That would be a disaster. Okay, the Centers for Disease Control and Prevention. The National Center for Chronic Disease Prevention and Health Promotion is basically zeroed out in the president's budget. So CDC's Office of Smoking and Health is the nation's leading force in tobacco prevention control. It ensures comprehensive nationwide protection against tobacco-related harm. And the CDC's, Chris, what is DCPC's?
Division of Cancer Prevention.
Okay, it's Division of Cancer Prevention and Control. Thank you. The nation's leading force for cancer prevention and control supports advancements in cancer care, prevention, early detection, and access to care. These are totally proposed for elimination in the president's budget request. And together they're about $655.5 million. We're also pushing for this not to happen in the president's budget. The next thing is the Injury Prevention and Control Center in CDC. This works on opioid overdose prevention. It's where the Drug-Free Communities grant program is subcontracted to. They are proposing to move the work of this center to the primary care subagency of the Agency for Healthy America, not to the behavioral and health part of it, where the rest of DFC is going to be. So This one is not slated for elimination. It is cut, but basically it's going to still be available. But the problem is that we need to make sure that they are put in, if they are moved, that they are put in the same place the Drug-Free Communities is put, because they are who subcontracts with ONDCP to run the day-to-day operations of the program. So they need to be in the same component if in fact this happens. However, we're pushing for all of these programs to remain fully funded and remain in CDC if possible. So, final thoughts on the president's budget. How does the president's budget impact the field? Well, it proposes substantial cuts and zeroing out of a number of really important substance use prevention programs, and proposes to reorganize large parts of the federal government. So of the approximately $733 million in current funding for primary substance use prevention to stop and delay use, the president's budget would recommend retaining only, as I showed you, about 83.5 million of it, because we really don't think we're going to get to keep the 20% set aside in the block grant if they put all of those big block grants together into a behavioral health block grant. So many of the programs that fund our field are proposed for cuts, eliminations, and proposed to be moved to this new administration for a Healthy America. And this could impact programs in ONDCP, SAMHSA, and CDC. So the president's budget proposal proposes to reorganize what's left by cutting drug-free communities, as I said, which we're totally fighting against. CSAT is proposed to be wiped out. The caps, I'm sorry. Let me move back. The president's budget proposes to reorganize what's left of substance use prevention into AHA. This is what they're proposing. So what would be in AHA for substance use prevention would be the drastic cut to DFC. So the 70 million that's left would be maintained but moved to AHA out of ONDCP. The caps, which are really the PTTCs, are proposed to be level funded at about $9.4 million. So that's the technical assistance and training that CADCA, that CSAP has done. And then the substance use, Chris, again, what?
Substance use prevention, treatment, and recovery services block grant.
No, the SUD, the substance use. Well, anyway, we have an acronym and I don't even know what it is, but it's what was the science to service stuff in CSAP is proposed to be funded at $4 million. And that is going to put together substance use prevention and mental health promotion, and try to put those together and get that out to the field, which we don't support. And then the behavioral health integration block grant puts the 20% prevention set aside in the substance use prevention treatment recovery services block grant at great risk. That's currently funded at $401.6 million in FY25. Again, largest single source of funding for substance use prevention programming across the country. So what's left is basically 83.5 million out of what was the 750 million for substance use prevention. So we're obviously fighting very hard for this not to happen. So what can the field do moving forward? As I've said, CADCA has been working since the forum on making sure that this isn't what happens. But reaching out to Congress really matters. The more Congress hears from you as constituents, the more likely they are to try to save substance use prevention programs. CADCA will be sending out legislative alerts on the recommendations that we just reviewed. So we told you we want to keep everything in the Center for Substance Abuse Prevention fully funded. We want to make sure that the that our, oh my gosh, I'm sorry, guys. I'm very upset by what's being proposed, obviously, so it's upsetting me. So for the drug-free communities program, obviously, we want the program to stay at ONDCP. We want it fully funded at $109 million with all the technical assistance and training, with money for new grantees, making sure that ONDCP can still, subcontract the program to CDC, and that the whole thing works. So please visit CADCA.org to sign up to receive legislative alerts if you are not already signed up, because we need the field to continue to weigh in and reach out to your elected officials about all of this. We have a list of important members of Congress to contact. This will all be available when we get out the recording with the slides tomorrow for everyone on the phone. I don't have the time to go over all of this, but there are very important people on the Appropriations Committee. If one of these people is your member in the House or the Senate, your reaching out is extremely, extremely important. And please do. So the important members of Congress are also members of the House and Senate Financial Services and General Government Appropriations Subcommittee, which oversees the drug-free communities and CARA programs. They're listed here. Members of the House and Senate Labor, Health and Human Services Appropriations Subcommittee, which oversees the SAMHSA prevention programs. We have listed here. Again, you're going to get all of this information tomorrow when you get the recording of this webinar and all of the slides. So why do these members really matter? Because they're the ones who are ultimately going to decide how much money is appropriated for drug-free communities and CARA, the programs currently in SAMHSA, including the Stop Act grant programs, the Strategic Prevention Framework Partnership for Success grant programs, and the Substance Use Prevention, Treatment, and Recovery Block Grant, and its 20% set aside. All of these programs are absolutely critical infrastructural programs for the substance abuse prevention field, and we need the field to come together to advocate that they continue to be fully funded. We have a lot of support, but we really need people to be hearing on the Appropriations Committee that these programs matter to the people who vote for them, their constituents. All politics is local. You guys are extremely important as constituents. And you have very important information to provide about how this little bit of money in the federal government has had gigantic impacts on reducing population levels of substance use in your states and communities. You have the data, you have the information, and we need to share it. This is really critical. We need you to be vocal. We need you to speak up. We need you to call and write your legislatures, respond to the legislative alerts we're going to be sending out, leave messages with legislators' staffers. You can write an op-ed or letter to the editor about how important these programs are in your state and in your community. You can try to get media involvement and basically ask questions if there are any town hall meetings with your members of Congress. We need to really have people speaking up. We also need to prove our value. You need to share the outcomes from your programs. We have amazing outcomes from all of the substance use prevention programs. And we need to share with elected officials what we've achieved with tiny bits of money, why what you do matters, and why the programs that fund you are critically important and need to be fully funded. We at CADCA have done a lot of this. We have shared all of the outcomes from the DFCs with all of the members of the appropriations subcommittees that fund the program. We've done the same with the Partnership for Success program in CSAP. We funded funding charts with how much money goes into each state and district. We've done a lot, but they really need to hear from you, their constituents, who are the people that are working every day to reduce youth substance use in their states and their districts. Can we win? Yes, I think we really can. I think we're on our way. We've made a great case, but they have to hear from their constituents, the people who are doing the work in their districts and states every day with the little bits of prevention money that we have. Can we afford to lose? No, we really need to work to make sure that we can protect as much of the money for substance use prevention as we possibly can across all of the federal agencies. And can we afford not to try again? No, we need to do everything we can to protect the money for our field. So this is Representative Hal Rogers, every time he speaks, says the following quote, "Policy without appropriations is a hallucination." So we have to fight for the money that funds our field. We have to. This critical time, we're still on a gigantic opioid and stimulant crisis, and substance use prevention is critically important to solving the substance use problems facing our nation. And I'd like to just sort of end with a Helen Keller quote, "Alone we can do so little, together we can do so much." Do not give up. Keep the faith. With your help, I really believe we will prevail. We've made great strides in convincing members of the appropriations committees in the House and the Senate, both Republicans and Democrats, that these programs are critical infrastructure for the substance use field in general. Prevention is critical. It's already totally underfunded, and we can't afford to end up losing most of the funding for the front end of the substance use continuum. So I'd like to say, please join CADCA, please be a member. We serve as your voice on Capitol Hill. We are the champions for funding the whole prevention movement, all of the money, not just for coalitions, but all of the money government-wide that funds substance use prevention. So please join CADCA if you're not currently a member. And I will say membership is what pays for me and my team to do all of the advocacy on Capitol Hill. So being a member of CADCA now is more important than it has ever been before. And now I'm going to open it up for some of the questions that have come in over the time that I've been speaking.
Yeah, so thank you, Sue, first of all. One of the questions I'm seeing towards the end of the recording is, or the webinar is, when do the final decisions get made, and when do we know when these numbers might be?
All right, that's a great question. Nobody knows the answer to that because as I showed in the beginning, the appropriations process for the past few years has gone way, way, way over with continuing resolution after continuing resolution. It's going to be very interesting to see if we end up with a budget or a continuing resolution. Our best bet would be if the House and the Senate can't agree on everything, and if we end up with a continuing resolution, because that would mean that we get to keep the 2026 appropriated levels, excuse me, the 2025 appropriated levels into fiscal year 2026, which is what happened in fiscal year 2024. We had a continuing resolution, and so everything ended up being at, for this fiscal year that we're in now, at FY 2024 levels. That's the best we can hope for, is that we get to keep the money that we have, and that they just can't get to an agreement. And it's starting to look that way, and that might happen because a lot of the appropriations schedule is moving very slowly and behind schedule because of all that's going on. So we will keep you updated. We do legislative alerts. So anytime anything is going to be marked up, we'll let you know what happens. And we'll also let you know when you can weigh in. We're going to be getting legislative alerts out on what I just told you about so that you can tell your members of Congress you have problems with what's being proposed in the president's budget for prevention.
Another question I got is from Carol, who asks, is this acceptable for prevention people to educate and advocate to their?
Yes, absolutely. It is critically important at this point because this is survival for the field. We really need members of Congress to hear from their constituents that these programs are critically important, that they form the infrastructure for substance use prevention in the communities and states across the country, and that without them, we're going to end up seeing substance use trends go in the total opposite direction. We've been really doing a great job in general, bringing substance use rates down for alcohol, tobacco, and prescription drugs, and we would want to keep that going. And also last year, we saw that the highest level of abstinence across those three substances ever really recorded. And we need to keep that going, and we can't keep that going without the funding for the substance use prevention field. And as I said, it's such a tiny amount of money in the scheme of things. It's unbelievable that it was cut. And the last thing I'm going to say too is that these programs are not duplicative and they're not too small to make a difference. And I think those are two very important points.
Another question I have is, do we foresee any cuts to opioid settlement funded programs?
No, because that has nothing to do with the appropriations process. The opioid settlement money is totally separate from the appropriated money that I'm talking about. Interestingly, it's a wonderful question, and I'm glad you brought it up. One of the reasons that the administration is giving for cutting so much of the substance use prevention and treatment infrastructure is that the settlement funds are available. And those funds were supposed to supplement, not supplant, the substance abuse prevention and treatment funding that is appropriated. So no, those funds will still be there, but we need those to be in addition to this money, not instead of it. And that's one of the reasons that's being given for these types of cuts. So thank you so much. That's a very good question.
Another question, and it's sort of a two-part question, is would new grants be considered DFC years 1 and 6? And then
okay, hold on. Yes, new grants would be, well, no, new grants would be new years 1 and 6. Yes, that's absolutely right. Right.
And then the second part of that question is, are year 6 DFC grantees in 2026 considered in the 600 grants, or are we considered new grants?
Oh, no, if you've already been funded for years 6 to 10, you're a continuation. Okay, so if you're a year 1, you're a continuation. So it would be after year 5, you'd have to reapply. That would be a new grant, and any new grants. So if you're years 1 to 10 already in the program, you're in the 600. Okay, the 150 would become next year's new years 1 and year 6s. Current year 1 and year 6s are in the program. However, as I said, even if you're in the program already, don't think that you're safe, because if the 70 million gets done, to be able to run the program, have technical assistance and training, be able to do an evaluation, have staff people funded, there's no way that they can continue funding even 560 grants or whatever I said. They're going to end up cutting the grants that are in the program already. Therefore, you're all at risk of, even if you're funded, being funded at a lower level. So we need to really fight that.
If the federal government replaces grants with block grants that goes to the states, would current grantees be able to have access to the state funding or have priority?
No, it would be a totally new program that would combine substance use and mental health together, and then sort of open it up for the states to decide who to fund. So no, I don't think anybody would. It's a totally new program that takes the money that exists in the state opioid response program, the mental health block grant, and the substance use prevention, treatment, and recovery, puts it all together, and it's basically a new program. So one, not clear if the 20% prevention set aside would still be in there. If it was, it's not clear what it would go for. And 3, this is a totally new program, and it also, as I said, cuts, when you put those 3 together, cuts the total by almost $500 million. So I don't think anybody who's currently funded would be getting priority. Would be a totally new program.
All right. The next question is, if we are in the first year of a STOP Act grant currently, would it end in October of this year if the budget were to pass?
That is a very good question. Well, that would be for next fiscal year. I don't think they're going to actually pass the budget by the end of September, or have a new fiscal year that starts October 1st with the budget intact personally. So no, I do think that we have to watch it, but we're fighting very, very, very hard to continue that program. It is the only underage drinking program in the government. So if this went into effect eventually, yes, then you would probably lose your funding, but we're fighting for that not to happen. And I also, given we've shown you that the appropriations process since 1992 has not, what year was it? There hasn't been a full appropriations bill in years and years.
1997.
1997. So my prediction would be, hopefully we end up with a continuing resolution that continues to fund everything at current levels. That would be our absolute best outcome for all of this. If any of this happens, then yes, things could end up defunded. That's why we need to fight and make our case now.
Marnie asks, and I've been told to speak louder, so I'm kind of shouting, is the budget bill different from the big beautiful bill?
Oh, the big beautiful bill is the reconciliation bill. Yes, the appropriations bill is different. However, the big beautiful bill basically will define how much overall money there is in the federal government for different things. The appropriations process is somewhat based on that, but they're two different processes. However, if something goes through in the big beautiful bill, then we're in trouble, but most of our stuff isn't included in that.
If we don't have a legislator on the list, should we reach out to legislators in other states?
No, reach out to your own legislator, even if they're not on the list, because you can ask them to speak to their colleagues who are on the list, especially to the chair and ranking members of the appropriations subcommittees that include these programs. So for drug-free communities and CARA, it would be the Financial Services General Government Appropriations Subcommittee Chair and ranking members in the House and the Senate. And for all of the Center for Substance Abuse Prevention stuff in SAMHSA, it's the Labor, HHS, and Education Appropriations Subcommittee and committee chairs. And they can talk to them and make the case. So definitely you need to talk to your own members, even if they're not on one of these, especially if they've made these programs priorities, they will help us push.
If there were a continuing resolution passed, what would happen to those federal programs or staff that were eliminated?
That's such a great question. The federal programs themselves would be funded. The staff that are eliminated, like the CDC excessive alcohol program, I don't know that those people are coming back, but in some of the cases, some of the people who have been let go have been rehired for certain things. So if there's a continuing resolution, the programs themselves, this is what I said in the beginning, where there's a million ways to cut something. The money could be there, but the people who run the program might not be. So that becomes really a problem with getting the money out. That's an incredibly great question. And this is all very complicated, and this has really never happened before. This is a very new environment that we're in the federal government right now.
Another question is, will new grants that include SPF grants and others like them be appropriated within block grant funds to states?
No, I mean, those programs are slated to be gone, and the states then will have parameters of how they can spend the consolidated money, and then it's going to be up to the states to decide how they spend the money. And obviously, if that new block grant is done, they're going to have regulations on, at some point, how you can spend the money. We're hoping that gigantic new block grant doesn't happen for exactly that reason.
Robin asks, how do you advise us to continue with our employees who are paid for out of the DFC grant?
Yeah, well, just continue. You have your money through the end of this year. The program was not slated for elimination. It was just slated for a cut. We're working to make sure it isn't cut. I wouldn't do anything different right now. Keep your employees. You're still receiving money. I wouldn't change anything at this point.
Do you think there will eventually be funding for DFC communities in years 10 through 15?
Oh, well, that was something that we were pushing really hard for. That was in the House bill that passed. At this point, no, I don't think so. I think that we need to work to save the program as it is. That we did great last year and got years 10 to 15 included in the DFC ONDCP reauth bill that passed the House, but it never ended up passing the Senate. It didn't become law. At this point, this is about survival and it's about keeping what we have. We need to fight for every dollar we currently have. Yeah, we're not going to be getting anything through that's going to change anything much. We just need to keep what we have intact.
Okay. The next question is there a tiered negotiation strategy in the event that some of the cuts must be made?
Yes, obviously, we need to make sure that the infrastructural programs for substance use prevention are maintained. So that would be in the Center for Substance Abuse Prevention, the SPF Partnership for Success program is extremely important. We need to make sure that the block grants are not consolidated with the mental health block grant. If anything, we, as we said, could support putting the state opioid response grant program into the block grant over time. Really, really important, and all of the STOP Act programs. So anything that directly funds the substance use prevention infrastructure are the most important programs. We're obviously fighting to keep all of CSAP funded, but those programs are the most important. The Drug-Free Communities program, incredibly important, in the CARA enhancement grant program. So, you know, we basically have those at the top of the list because they fund the infrastructure that does prevention at the community level.
Okay. What is your advice for staff funded through the SPF-PFS beyond this September?
You know, we're fighting to keep that program. It's an incredibly important infrastructural program. And given, let me just say, when it comes to like worrying about lobbying regulations, if in fact you are slated for elimination, then you need to call your members of Congress and tell them what you do, why it's important, and the program has to be maintained and what would be lost. So I think we have a great chance at hopefully keeping that program funded because it's an amazingly important program. So, you know, everybody needs to do what they can to advocate to keep it funded.
Okay. And I'm also seeing questions about, is this being recorded? Will the recording be sent out? Will the slides be sent out? The answer is yes, they will be. And the answer to when they will be is tomorrow. So we thank you all for your patience.
And also, I think the last slide is my contact information and Chris's.
Yes, it is. This is yours.
Okay, so this is my contact information. I'm happy to have people contact me. Chris Dorn, who's sitting next to me at CADCA, is CDOARN@cadca.org.
And you can also email the Public Policy Departmental inbox, which is publicpolicy@cadca.org.
We will answer any and all questions. We are happy to, we know that this went over time, and we know that people have questions, and we will answer any questions that come in. We're happy to do anything that we can to answer your questions and to be helpful. And we hope that this provided important information to all of you. I will say, please respond to the legislative alerts. We need to flood Congress. If you need to know who your members of Congress are, contact publicpolicy@cadca.org. We will let you know if you don't know. We can let you know who the staff people are that work on these issues for your members of Congress and your senators. We will do anything we can to help you because grassroots advocacy, people hearing from the field, is extremely important. So your voices, they matter, and they're going to make a really big difference moving forward here.
All right. We do have some more questions if you have time.
I have time.
Okay. The SINAR program is a federal requirement
Mhm.
through the SINAR amendment and depends on the prevention set aside. If these cuts go through, states may not be able to maintain compliance. Is there any recognition of this among the people who are making these cuts?
Oh, yeah, probably not. But I get it. I mean, if they, redo everything, who all bets are off.
Paige asks, do I understand correctly that this has already been voted on by the House?
No.
Okay.
No, this has not been voted on yet by anybody. This is the president's budget proposal. The House has not marked up yet. What I said was, in talking to staff on the Appropriations Committee in the House, we were led to believe that they would probably go along with this Agency for a Healthy America. But and these were Republicans who told us this, but they were not going to go along with all the proposed cuts. So none of this is passed yet. That's why we were having this call. You still have time. We still have time to make sure that this isn't what ends up happening. Congress does have the power of the purse. That was the first slide that we showed. They are the ones who make the funding decisions. This is the president's proposal to Congress. Congress doesn't have to go along with all of it or any of it. And the more Congress hears from constituents, the more likely we are to save some or all of the programs. So no, none of this is final. And in the end, none of this might happen if the House and the Senate can't come to agreement in the end. We could end up with a year-long continuing resolution that keeps everything at this year's funding levels. So nothing's been decided. That's why we are doing this now. And we're doing it now. Again, it's late because the president's budget only came out a couple of weeks ago. So that was when we got to see exactly what was being proposed.
Somebody asks, how much is being invested to create a whole new agency or administration?
Yeah, we don't know. I mean, the interesting thing is if you look at the president's budget for the new Agency for Healthy America, they just have funding levels for FY26, the year they're asking for the money for. They don't actually have any levels in for FY25, FY24. So therefore, you have to actually know what was proposed previously to understand how much they've cut. And because we keep track of all of that, we were able to tell you all of that. But that's the other thing. Congress might not in the Senate go along with the Agency for Healthy America. Not clear at this point. So that's why we need to fight. And that's why when I put what we're asking for, we're asking to keep SAMHSA intact. We're asking to keep CDC intact. We are not looking to have stuff cut to the bone and then moved into this new agency. I guess what we're saying is if the House decides to do that, we want to make sure they protect the programs, or if Congress decides, but none of those decisions have been made. The other thing is, it's usually the authorizing committees that restructure the federal government. It's usually not done in an appropriations bill. So in this case, they're trying to restructure all of HHS in an appropriations bill. And we're hoping that the Senate doesn't go along with that Senator Capito, who is the chair of the Labor, HHS, and Education Subcommittee, decides she doesn't want to reorganize all of those departments in an appropriations bill. So anyone from West Virginia, she's the chair. You have more say than anybody else. You need to contact her and her staff. Call us and we can set that up for you if you're from West Virginia.
Another question that we have, which is also a two-parter, is could we create a draft email for our senators, and does CADCA have talking points for our elected officials?
Yes, that's what we're going to be getting out is the legislative alerts on these issues. We have packets of information that we have available. Anybody that wants that, Chris, which email do you want them to?
So again, the email to get the talking points, the email prompts, that sort of thing is publicpolicy@cadca.org. I'll put that in the chat. Barry Price asks, are there actions that the field should be doing with local politicians and state officials like NPNs, SSA, and governors?
Yes, absolutely. If you're in, well, yes, I think you should definitely be talking to the people in your state agencies. That's a wonderful question, but they're looking for us to be able to be the voice on the Hill, because especially if the SSAs are in Republican states, the governors are going along with a lot of this. So to give you an example, the okay, which program was it? Hold on. The administration had proposed to take away the funding from, now I have to think of what the program was. But the Democratic governors sued, it was ARPA, no, whatever. I'm sorry, I don't have my notes in front of me. No, hold on a second. Anyway, yeah, I'm sorry. It was money to states from the COVID response money. Anyway, it was proposed to all be zeroed out, and then the Democratic states sued, and then they put and none of the Republican governors joined that suit. So it is the Democratic states that are going to actually be able to get the rest of that money.
It was ARPA, according to.
It was ARPA.
comments.
Yeah, that's what I thought.
Thank you, everybody who commented ARPA.
Yes, thank you. It was ARPA.
Another question we have, and this might be the last question, is if SPF-PFS is eliminated in the FY26 budget, would they still allow us to do the no-cost extension to use up our remaining FY25 funds to finish up activities, or would they take those funds back?
That's a great question, and I'm not the right person to answer that, but I will, under the table, try to get you a question. Hopefully that's not what's going to happen. Hopefully we will be able to save that program because it's a core infrastructural prevention program that we're fighting very hard to make sure is not eliminated.
All right. Seeing no more questions in the Zoom. And oh, here we go. Could we point out which senators and representatives we should make a priority? I'm sure certain legislators are on board with PFS, DFC, and be preaching to the choir with them.
Oh, well, keep preaching to the choir with them. People need to hear from their constituents now that these programs are a priority. Even if you don't have a member on the Appropriations Committee or one of the Appropriations subcommittees, if you tell your member this is really, really, really important, they themselves can talk to the members who are making these decisions. So your best bet is to talk to your own elected officials. They're most interested in hearing from their own constituents. And as I said, we got a lot of support across the government, across the Congress when we did our appropriations requests. A lot of people put in all of these prevention programs as their priorities based on the work that we did before the budget came out. And even people on the Appropriations Committee have called us to say that they're pushing for what we asked them to push for. I just think they need to hear from constituents now to reinforce that what we said at the beginning of the process is still a priority to you, the people who elect them.
I think that's all the questions that I am seeing in the Zoom and the YouTube. Sue, do you have any closing?
Yes, I just want to say ARPA is the American Rescue Plan Act, whatever it was, COVID money, specifically for substance use prevention and treatment. So anyway, that's the ARPA money. Sorry about that. I had a brain fart for a minute.
It's all right. And then just to close, again, that departmental email is publicpolicy@cadca.org. Sue's email is there on the PowerPoint, and we will get out a copy of the recording and a copy of the slides tomorrow. So thank you everybody for attending. I know it's a lot of information, but CADCA is here working for you. So thank you.
And if you're not CADCA members, please join. There's strength in numbers, and the more members that we have, the stronger that we are. And membership is what funds my team at CADCA to do all of the advocacy on behalf of the field. And we need as many people to be members as possible so that we can continue to do the advocacy on behalf of the whole field. So thank you, everybody, for joining. We